Hello, this is Dr. Gay from First Look MRI, and this is a 20-year-old female with history of recent injury. She's having pain on the medial and lateral knee, but most pronounced laterally. The physician was worried about a tear or injury of the lateral collateral ligament complex. So we're going to look on the lateral side of the knee to see if we can see that or not. And this is a view called a Coronal T1 image where we can see bright signal within the marrow that has a lot of fat, and also bright signal in the subcutaneous fat out here. The muscles are gray and the tendons and ligaments are really dark. And so on this view here we can see the lateral side. This is a little triangle, lateral meniscus. This is another triangle, the medial meniscus, and the menisci look good. This is again the lateral side. Now we're going to look for the lateral collateral ligament complex. So this is the iliotibial band where anterior, this comes down here and attaches. So we're going to go to the central part. Now we're going to go posterior. So the lateral collateral ligament complex is in the back here. It has two components. This is the biceps muscle belly coming down. It blends into this dark band here. This is the central tendon of the biceps. And about right here, it becomes the conjoined tendon. It will get a component from the fibular collateral ligament, which is right here, that comes off the femur. There's a thin tendon here called the fibular collateral ligament that's going to come off, down, 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 and it's going to blend right with this biceps to form the conjoined tendon. So the conjoined tendon looks good, the biceps muscle and tendon look great, the fibular collateral ligament over here looks great. So I do not see a tear or rupture of that lateral collateral ligament complex. So we're going to keep looking over here. There's one more thing just deep to this fibular collateral ligament right here. There's a little area of the lateral femur that's concave, and from that originates this little dark thing here. This is the Papateol's tendon. It's going to come out and go backwards, backwards. There it is right there above the meniscus. It's going to loop behind the meniscus. We can't really see it there. Eventually it'll loop down here, and there's a big muscle. There's the Papateol's muscle, Papateol's tendon. And that looks good. I do not see a Papateol's tendon tear. It looks pretty clean. To see this on the axial images, this is the Papateol's here. This is the front, back, and the Papateol's tendon comes here. It's going to go backwards from the origin, and it's going to loop around the outside. And here it is right in here. It's come down. This is it right here. And become this muscle. So this is the Papateol's muscle. It looks nice. It hugs the back of the tibia. If we follow this back up, you can see these little dark areas. These are the central tendons coming together, forming that Papateol's wrapping around. So there's no Papateol's tendon rupture, no muscle tear. But there's something else out here that looks a little funny. There's bright signal here, really subtle. There's a little linear thing hanging out here. Looks like it ends blindly. And this is a really rare injury along the lateral side. This is what we call a posterior lateral corner injury. This is a posterior lateral, so it's called the posterior lateral corner, and these components I've spoken about are all components of the posterior lateral corner, and this is one of the final ones. This is a tendon that goes over the back of the Papateol's tendon, a ligament rather. It's called the Popliteofibular ligament, and that will hold the Papateol's tendon close to bone. And it's very rare to see this thing torn, but in rare injuries like this one, they can have a tear. And it's most commonly described when people have ACL injuries. They have an ACL tear, they get injuries in the posterior lateral corner, and this is one of the components you need to look for. And it's very rare to see this isolated. I'm not even sure if I ever have seen an isolated tear of the Popliteofibular ligament, and that's why I'm showing it. But this little piece right here is part of that ligament that is elevated and a little bit of fluid around it. This is a sagittal view. This is the Papateol's muscle. It comes up, it's making a turn here, and it's going to turn into the tendon. And the tendon is going to come back over here. And the tendon wraps around. And deep to that tendon, you can barely see the tendon there. Superficial to that rather, we see this linear band that's elevated. We see this bright band of fluid or inflammation along the peripheral rim. And this is the torn Popliteofibular ligament that's thickened and elevated, and a little bit of edema or hemorrhage surrounding that. So an isolated tear of the Popliteofibular ligament. We can see this on one more view here. This is the coronal protein density fat press sequence. This is the Papateol's tendon right there. It's going to come down, backwards, wrap around this meniscus. There it is. There it is. Here's the muscle. And then we're going to try to find that ligament. And so right over here we see this horizontal band. That's the popliteofibular ligament that's torn. This is the part of it that's dropped down, and again that edema or hemorrhage surrounds that. Here's part of it right there. You can see this is the popliteus tendon right adjacent to it. So ruptured popliteofibular ligament that's isolated, and that is the explanation for their lateral sided pain. They had a couple other little tiny things, tiny little bone erosion right here, and they also had one other finding that's worth mentioning over here. This is the kneecap, right beneath the kneecap, and Hoffa's fat pad, this fat pad here. Laterally, there's a little bit of foggy brightness. This is what we call fatty impingement. There's abnormal mechanics of stress, and the fat gets pinched and causes irritation and edema in that fat, and we call that fatty impingement. And that's it. Thank you very much.